Wait. Okay, so we are going to start with Mhm. better, but we can focus on the hello. Mhm. Mhm. Okay, so the posterior triangle of the neck is mainly uh, here is the posterior triangle. You can see this is sternocleidomastoid, mainly the posterior border of the sternocleidomastoid, and the posterior border is by the anterior border of the trapezius. Base will be in the middle of the clavicle, middle third of the clavicle, and apex in the meeting point of these two bones. Mainly the posterior border of the sternocleidomastoid and the posterior border is by the anterior border of the trapezius. Base will be in the middle of the clavicle, middle third of the clavicle, and apex in the meeting point. Okay. Okay, so here we can see the boundary again apex, anterior border, posterior border, and the base. Base is the middle third of the clavicle, anterior border, posterior border we have seen, and apex. Okay, very rapidly we'll see the posterior triangle of the neck. Mm-hmm. boundary, nerve, and basal, muscle, and lymph node. Nerve we need to remember properly because this is a simple way we can remember AP, BP, CP, and GAN. AP means accessory nerve, P4 phrenic nerve. BP3 means upper three trunk of the brachial plexus. CP is cervical plexus. Which plexus? Which branches? Supraclavicular, transverse cervical, and greater auricular nerve, and lesser occipital nerve. Lesser occipital nerve. Okay. Vessel, one artery, one vein. Which artery? Subclavian artery. Which part? Third part. This is the exam question. Which part of the subclavian artery remain in the posterior triangle? Third part of the subclavian artery. And vein, which vein? External jugular vein. And muscle will be scalene muscle. How many scalene muscles are there? We know three scalene muscle. And posterior belly of omohyoid. Little bit we need to know about the omohyoid because omohyoid is the muscle which is this is super, this is the superior belly, which is dividing anterior triangle in between carotid triangle and muscular triangle. And when it is coming in the posterior triangle, it is dividing into superior posterior triangle and inferior posterior triangle. Okay, posterior triangle also it has superior and inferior. It is being marked by inferior belly of omohyoid. This is omohyoid, and here also in we have anterior belly of digestive, and this is the posterior belly of digestive. Okay, this is external jugular vein remaining in the posterior triangle. Now just here, just here in the beginning. It is arising from here. Here, exactly this part. See, here, there. We will get some more clear picture. It will be easy for you. And these are the nerves. Now come to the parotid gland. Parotid gland, very basic, four in number, and they located just behind the parotid gland. Okay. Embryology, you need to see blood supply same like superior and inferior thyroid artery. Same the thyroid artery. This is thyroid gland overall, and parotid will remain just behind the thyroid, four in number, like this. Same blood supply as like thyroid, and their relation medially you can see this is this yellow fiber, this one also. These are the recurrent laryngeal nerve. And if we go laterally, this is carotid artery. So generally, you can see the relation laterally common carotid in both sides. Laterally, there will be common carotid, and medially recurrent laryngeal nerve. Anteriorly, if we see anteriorly in front of parathyroid, thyroid gland will be there, and posteriorly pretracheal fascia. Very simple. Now pretracheal fascia. Posterior will be pretracheal fascia. Now, let me see your question. Just have a look of thyroid gland. दिखता क्या है थोड़ा अच्छा Okay, so now we are in thyroid gland. Thyroid gland, very important. Just a simple concept. Thyroid gland has two lobes, right lobe and left lobe, and they are connected by a isthmus. Okay, so this is just basic about thyroid gland, and then we are discussing about, yeah, we'll continue. So thyroid gland, it has two lobes, right and left lobe, and they are connected by isthmus, and they have sometimes an accessory lobe which is called pyramidal lobe, like this. Mainly this is thyroid up to here. Now, okay, now screen is visible. Mm, okay, let's see. Okay, from thyroid, from the point of exam, what we need to remember: thyroid development and thyroid artery and its relation. Okay, so thyroid, mainly we need to know its relation and its arterial supply. Very simply try to remember. Its blood supply will come from two sources. Arterial supply will come from superior thyroid artery and inferior thyroid artery. Simple. Superior thyroid artery, it comes from the first branch of the external carotid artery. When we'll read in details about external carotid, we will get the first branch. It gives supply to superior thyroid artery. And inferior thyroid artery, it comes from the thyrocervical trunk, subclavian artery. Remember subclavian artery? We studied the branches of the subclavian artery. That is, what were the branches of the subclavian artery? Nasha, you remember what were the branches of the subclavian artery? It was vitamin C and D, VIT, Okay. Yes, yes. So thyrocervical trunk, it was for T, VIT. That that T was for thyrocervical trunk. So inferior thyroid artery coming from the thyrocervical trunk, superior thyroid artery coming from the first branch of the external carotid artery. Sorry. And in 10% population, they have thyroid ema artery. Not all the people, only 10% people will have thyroid ema artery. If they have, they will come from either from brachiocephalic artery or from the aorta. This is the exam question. They ask question from thyroid ema artery. So once again, you can see thyroid gets supply from arterial supply, superior thyroid artery, inferior thyroid artery. You can see here, this is the thyroid gland. Okay, so it is getting supply from superior thyroid artery, which is the first branch of the external carotid artery. This is external carotid artery. Okay, and inferior thyroid artery, it is coming from, yes, from thyrocervical trunk. Mainly inferior thyroid coming from thyrocervical trunk from first part of the subclavian artery. And in 10% population, there will be thyroid ema artery, which may come either from brachiocephalic artery or from the arch of aorta. Now, venous drainage. Venous drainage will be little different. In artery, we had only superior thyroid artery and inferior thyroid artery. But venous drainage, it will have three. One is superior thyroid vein, inferior thyroid vein, and middle thyroid vein. Okay, see, superior and middle thyroid vein, they drain into internal jugular vein, and inferior thyroid vein into brachycephalic vein. I have to read multiple times, then it will be clear. Again, this is okay. Then see their orientation, how they place from the behind. This is the bone. Okay, this is bone. Then we have esophagus. Then we have trachea, and it is encircled or covered, not fully encircled. It is covered by thyroid. And lateral in both sides, there is a capsule like this or the fascia, which is called carotid sheath. In carotid sheath, there will be three structures. Mainly, what are the structure? Common carotid, vagus, internal jugular. Yes, internal jugular, internal jugular. So internal jugular will remain most laterally. This is internal jugular. You can see it will remain most laterally. Then medially will be carotid, and vagus will remain posteriorly. Okay, so this is again carotid sheath. What are the content in carotid sheath? Internal jugular, common carotid, and vagus. Vagus. Okay. Now the tongue. Mainly, exam question comes from tongue, mainly from their nerve supply, their muscle. Mainly the nerve supply. So tongue has got both sensory and motor. Okay, tongue has got both sensory and motor. With our sensory supply, we get the taste sensation, right? And from motor supply, we have the movement of the tongue. So motor supply, all the motor innervation is provided by the 12th cranial nerve, that is hypoglossal. Hypoglossal. Okay, Nasa, can you tell me the name of the 12 cranial nerves? What are the 12 key cranial nerves? Mm, yeah, either any one of you. No, no. It should be according to the serial. Nasa, you can try. Oh, you are muted. You need to unmute. Yeah, all the cranial, 12 cranial nerves. No, no, no. It has to be very clear, and we cannot miss any serial. Facial number what? Facial number. Then spinal accessory, and 12 is hypoglossal. Okay, yeah. So make it more smooth. We cannot miss the serial, and the response should come very rapid. Okay. So hypoglossal is number 12. All the motor muscle comes from hypoglossal. That is number 12, except palatoglossus. Except palatoglossus. This is the exam question. Typically, they ask from here. All the motor muscle of the tongue is supplied by the hypoglossus except palatoglossus, which is supplied by the vagus. Palatoglossus, vagus, palatoglossus, vagus. Like this, try to remember. Palatoglossus, vagus. Okay? Like esophagus, vagus, esophagus, vagus. In abdomen, we studied like this. Esophagus, and vagus, they both cross the diaphragm at which level? Yeah, very good. T10. T10. And now here palatoglossus vagus. Palatoglossus is supplied by the vagus. All other supplied by hypoglossal. Hypoglossal. Okay. Number is not a fact. You need to know the name. We will get it. We have extrinsic muscle, group of muscle, intrinsic group of muscle. Okay. So motor supply clear. Again, motor innervation is by hypoglossal, except palatoglossus, which is supplied by vagus. Now, sensory. Sensory, if you read from here, it feels okay. Okay. Sensory, it is divided into anterior two-third. You read from the down. Anterior two-third, posterior one-third, then the most posterior part. First anterior two-third. From this picture, you can try to see. This is anterior two-third of the tongue. This is anterior two-third of the tongue. And they have two sensation actually. One is taste sensation, another one is general, other. Taste by facial. Which one? Chorda tympani. It is written here. Okay. So again, anterior two-third of the tongue is supplied by lingual nerve. Okay. Mandibular branch of the lingual. We will read it again and again and we will get detailed explanation, but just remember, and taste sensation by chorda tympani from facial. Facial nerve, we know number 7. Number 7 has also many branches. It has one branch called chorda tympani. Chorda tympani give the taste sensation of our tongue. So if chorda tympani is injured, person will not get any type of taste sensation. Okay. Apart from the taste sensation, other sensation is carried out by lingual division of the mandibular or the mandibular division. Yes, and it is only in the anterior two-third, but posterior one-third, all sensation is by glossopharyngeal. Glossopharyngeal, which number? Which number? Glossopharyngeal is number 9. 9. That's why you cannot mix number. Glossopharyngeal is number 9. And the most posterior part of the tongue is by vagus. Vagus is number 10. So I made a picture for my memorization. You can see this picture. Anterior two-third, then posterior one-third, and from here we can consider it as it is the most lower part. Okay. So serially, if we give the number, first we start with number 5, then we go number 7, then we go number 9, then we go number 10, then we'll come to number 12. We'll see. Naz, you remember in carrot, of course, this is for sensory. Motor, we finish. All motor is supplied by hypoglossal. Hypoglossal. Yes, B3. This is mandibular division of trigeminal nerve. You are right. This is mandibular division of the trigeminal nerve. And trigeminal is number 5. And mandibular division of the trigeminal also has a specific branch only to the tongue, that is lingual. So mandibular division of the trigeminal nerve is number 5. So again, you can see the picture. In the tip of the tongue, we are having number 5 and 7. Okay. Okay. In the tip of the tongue, we will have five, which is which is which is mandibular division. Which branch? Lingual. We mainly focus on lingual. Okay. Even if you forget it is a branch of the trigeminal nerve, no problem. But you cannot forget this is by the lingual nerve. Tongue, lingual nerve. From where? It is coming from the mandibular division. From where? From the trigeminal nerve. Okay. So again, anterior two-third, it has special supply and taste supply. Special sensation is mhm, okay. So anterior two-third of the tongue is supplied by mainly two sensations we have. One is taste sensation, another one is spatial sensation. Taste sensation is specifically by chorda tympani, which is coming from facial nerve. Okay, and other general sensation is by lingual nerve, which is coming from the mandibular division of trigeminal nerve. So all finish anterior two third. Posterior one third, it is by glossopharyngeal. Glossopharyngeal. It is by number 9. And the most posterior part of the root of the tongue is by vagus. Vagus number 10. I also have a question. I will just, you can just revise and observe this part. Yes, brother. What happened? Hmm? Other. Hmm. ज्यादा बुखार, बहुत तेज बुखार, कैसा? आ, hmm. No, no, do nothing, just keep. Say tongue, do nothing, tongue normal. Mobile, you have mobile? YouTube? Data? Okay. Ethiopia? Oromo language? Hmm? Oromo? Name? Okay. Counter. You can go to counter now. Okay, reception. Okay, so we finished nerve supply of tongue. This is very important, and from here, be 100% sure. You will get one question in the exam. Okay. Again, very quick review, a clockwise review. Just remember the number 5, 7, 9, 10, 12. Okay, 5, 7. 5 is what? This is trigeminal, lingual nerve. Lingual coming from trigeminal, which branch? From mandibular branch. Then number 7 is facial nerve, which via which nerve? Chorda tympani. And they are giving supply to anterior two-third of the tongue. Which sensation? They are giving the spatial sensation. Okay. And taste sensation is by chorda tympani, and other sensation by lingual. And posterior one third all sensation is given by glossopharyngeal. And most root of the tongue is supplied by vagus. Root of the tongue is supplied with the vagus, Las Vegas. And before, if you have not forgotten, remember when we were discussing about triangle, anterior triangle of the neck, especially here, you can see the picture here, in this area. Which nerve will be here? This, yes, submandibular gland, submandibular node, and which nerve? Very good, you forgot. This is hypoglossal nerve. This is hypoglossal nerve. And this is exam question. This is the exam question, number 12. In digestive triangle or submandibular triangle, there will be nerve, which nerve? Hypoglossal nerve. So if you remember in this manner, initially it is starting by number 5, then it is going number 7. I'm trying to think about a tongue inside. Okay. Number 5, 7, then 9, then 10, and again when it is coming in this location, it is 12. So it is hmm, okay. Don't forget this clock. Once again, sensory, anterior two-third, oral, general sensation by mandibular nerve, yeah, and special sensation, mainly the taste, is by chorda tympani. And posterior one-third of the tongue, general and special sensation by glossopharyngeal nerve. Okay. Here, there will be the muscle, different muscle, some motor, intrinsic muscle, extensor muscle. Here, no need. Once you read it from EMRCS file, you will get it out there. Now come to submandibular gland. Okay, submandibular gland. This is submandibular gland. Okay. It is worse now. Okay, okay, okay. So submandibular gland. We need to know the relationship with the submandibular gland. Um, Superficially, submandibular gland. Yeah, here you need to focus on the relationship with other structure. Like some structure are superficial, some are deep. Okay, so mainly we need to remember facial vein, and marginal mandibular nerve. Okay, and cervical branch of the facial nerve. They all will remain in the superficial relationship. Mainly need to remember marginal mandibular nerve. Marginal mandibular nerve is in the superficial relation with submandibular gland. And in the deep, we have lingual nerve. Already we came to know that lingual nerve, it is giving supply to the tongue. Hypoglossal nerve, this one also we have seen. And submandibular duct, they are in the deeper structure. Mainly focus on submandibular duct where it opens. It opens lateral to the lingual frenulum on the anterior floor of the mouth, and it is 5 centimeter long. Submandibular duct, also called Watson duct. Watson's duct, it opens in the floor of the mouth. Maybe it is because the screen over there setup is not proper. Okay, your view option. You can look for your view option. Then you will be able to see the screen in a wider angle. Okay, I think at least it will come. Just it will come. Okay. A blurring option is related with the internet speed and this thing. But I think it's okay now. Okay. Okay. So submandibular duct, another name is Wharton's duct. It opens in the floor of the mouth at the lateral side of the frenulum. Okay. Now, facial nerve. Okay, here is the front of the facial venous vein is not necessary. Lymphatic vein is no need. These all uh, you will need in MRCS Part B, not for Part A. Okay, here no need. This is the lingual nerve. Lingual nerve coming from which nerve? Mm-hmm. Mandibular division of trigeminal. Because this is the exam question, and you will forget. Then parotid gland. Parotid gland. We need to remember. Uh, okay. For submandibular gland, we had duct. What was the name of the duct? Wharton's duct. Wharton's duct. And Wharton's duct was opening just at the side of the frenulum here. This is the frenulum, and it opened just at the side of the frenulum and this side. If it is blocked, it is called ranula. This is a condition when the duct is blocked, or if there is any tumor. You will get it in ranula. You will get it in part B. B. But just now you need to remember Wharton's duct, where it open, what is the length? That's all. Yes. And now parotid gland also has its duct, and it's called Stenson duct. Parotid gland will remain in the upper part, so it opens in the upper second molar teeth. This is you need to remember. Okay. Salivary duct coming from parotid gland, the duct we are getting, it is called salivary duct, and its another name is Stenson duct. And you need to remember the whole line. It crosses the masseter, pierces the buccinator, and drains adjacent to the second molar tooth. Everything you need to remember. Salivary duct, it crosses which muscle? It crosses masseter muscle. It pierces which muscle? Buccinator muscle. And where it opens opposite to second upper molar, upper, because it is coming from up. I don't know, you can see me. Okay. Parotid will remain here. So it will open here in the upper, not in the lower. If it is in the lower, it is submandibular gland. Okay. Phalas. Kullu phalas. Now, structure passing through the gland. I tried in my way, but if you have any better option, you can try your way. But you need to focus about the sequence, which structure remains before or after which structure. Structure passing through the gland. First, facial nerve, the most superficial structure. Most superficial will be the facial nerve. Then, second will be retromandibular vein. First is facial nerve. Second is retromandibular vein. Then we have another nerve, auriculotemporal nerve, and the most inner and most deeper structure is the artery. It is easy. Wherever any relation in our body where we have the artery, it will remain in the deepest structure. Okay, to protect. Yeah, to protect. Again, most superficial will be the facial nerve. Then we have vein, nerve, vein. So you remember nerve, N, then V, nerve, vein, again nerve and artery. N, V, N, A. N is nerve, then V is vein, then again nerve, then again artery. Vein and artery, they are not together. In between vein and artery, there is nerve, and initially it is starting with the nerve. Which nerve? Facial nerve, the most superficial. Again, facial nerve, then vein. Which vein? Retromandibular vein. Then again nerve. Which nerve? Auriculotemporal nerve. Okay. And it is also coming from V3. What is the name of V3? What is V3? Mm-hmm. Yeah, V3 is mandibular division of trigeminal nerve. And the most deeper is external carotid artery. The artery supply branches from the external carotid artery. Because external carotid artery going through it, so definitely he will give some supply to the gland. So simple. Artery supply branches from the external carotid artery, and venous drain is retromandibular vein, because this vein also remain here, right, in the parotid gland. And nerve innervation, parasympathetic, sympathetic, and sensory. Parasympathetic, secretomotor from otic ganglion. This is exam question. Parasympathetic. Parasympathetic means what? Means relaxation, right? In simple terms, if we just think normal, parasympathetic means relaxation. Means when we are sleeping, we are in a parasympathetic mood, and when we are active, when we are running, then we are in sympathetic mood. Yes, yes, yeah, yeah, same. Otic ganglion, foramen ovale. Uh, okay. Then parasympathetic secretomotor means when parasympathetic stimulation comes from otic ganglion, what parotid gland will do? They will do secretion. Okay. It happens during chewing, when we eat anything, when we chew, it happens from otic ganglion. I mean, stimulation comes from otic ganglion, and there will be secretomotor, secretion. When sympathetic, it comes from superior cervical ganglion. Superior cervical ganglion. How many ganglions we have in our body? How many ganglions we have? Okay, read. When you have free time, okay, from anywhere, from the books, from internet, from ChatGPT. We have superior cervical ganglion, middle cervical ganglion, we have inferior cervical ganglion, three ganglion. Okay, so sympathetic, we will read, don't worry, we'll get it in the future. Sympathetic come from superior cervical ganglion, and sensory from greater auricular nerve. GAN. This is the most difficult nerve. I forget every time, and mostly I make mistake from this question. I don't know why, but still I make confusion at this nerve. I don't like this one. Greater auricular nerve. Very difficult to remember. Greater auricular nerve. Greater auricular nerve. It will remain here, but it makes always confusion from where it comes. Either it is from facial nerve or it is from cervical ganglion. So late, while discussing, now I'm confident this greater auricular nerve actually coming from cervical plexus, right? Yes, GAN. We'll see GAN. I wrote it somewhere. GAN. AP, BP, CT, and last was GAN. See here, greater auricular nerve. Greater auricular nerve. Greater auricular nerve. It is coming from where? It is coming from cervical ganglion. Cervical plexus, sorry. Cervical plexus. Actually, these are the exam question. They will make you confused. Greater auricular nerve. It is also coming from cervical plexus. Not, this is a branch of facial nerve. Facial nerve also has three branches here. We will get. So now we are in submandibular gland, finish. Parotid gland, we have seen. Mainly remember from here, parotid gland, extension duct, where it open, which muscle it cross, which muscle it fires, and the structure fires through the parotid gland. Now, one of the important is facial nerve. This is exactly the same in MRCS Part B. Same thing, same. No. Yes. Can you remember the branches of arch of aorta? Just tell me the branches of heart chakra aorta and their branches. Hmm. Continue. If surgeon asks you during operation, eh, you are not supposed to. You need to read more. Um, need to be more smooth. Okay, it is very straightforward. Uh, Brachycephalic trunk, left common carotid, and left subclavian. I was trying to take you up to the carotid, but you okay. And right common carotid, right? Mm-hmm. Yeah. No, I was asking the branches of the arch of aorta mainly. So the branches of the subclavian artery, yeah. Superior thyroid artery comes from external carotid, and inferior thyroid artery comes from hypocervical trunk. Hypocervical trunk comes from the subclavian artery. Okay, just have a look. NVNA, F-R-E-A, Faria, NVNA, Faria, F-R-E-A, Faria. Faria is facial nerve. V is vein. Which vein? Retromandibular vein. Nerve. A, this A for which nerve? Just now we studied here. Relation. Parotid gland. What are the structures? Fires the parotid gland. That is, you can remember it like Faria. You can remember this one as like Faria. Faria is someone like the name. Faria. F-R-A-E. 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 So F is N. F relate, and we know this relation. NVNA. NVNA. So N for F, retromandibular vein. And another nerve is auriculotemporal nerve. And this A is external carotid artery. Hmm. External carotid artery. Hmm. nerve. Okay, so by this way, FRAE, FARIA or FARI, we can remember the relationship of the structure. Here, we can see this is the parotid gland, and these are the structure passing. First, we got facial nerve, then we have vein. Which vein? Retromandibular vein. This is the retromandibular vein. Superficial to deep. We are going superficial to deep. Then again, A is auriculotemporal nerve. The most confusing nerve is invisible here, auriculotemporal nerve. And then external, this is external carotid artery. This is external carotid artery. Okay. Yeah. Now, mainly we are focusing on the branches of the facial nerve after coercing the parotid gland. Facial nerve, we have to know everything from the skull up to the skin. Okay. So, facial nerve, when it crosses parotid gland, it divides into different branches. One branch goes up, it will be temporal, then zygomatic, buccal, mandibular, uh, cervical. ठीक
यार मैंने ना अभी डायबिटीज हो गया था सर।
हम्म
तो वो पहले हमने वो स्कैन करवाया था वो जो होता है।
जी जी
तो इसका अभी क्या चार्ज कर रहा है कि बॉडी चार्ज का?
फुल बॉडी का ठीक है आप कहाँ से
उनका
तो,
शॉफल बोल रहे चल रहे
जी
थे।
जी जी ऑफर है अभी ये आप काउंटर में दे दीजिए तो आपको बता देंगे
क्या चार्ज है?
वो काउंटर से आपको बताएगा ठीक है जब रिपोर्ट हो जाएगा रिपोर्ट के साथ आप आ जाइए ओके दिस पिक्चर इज मेनली फॉर द ओरिएंटेशन of different structure and when you have your free time try to watch this anatomy picture more and more especially with their labeling okay now we are entering into circle of wheels this is very important circle of wheels you have to remember the branches and you will get question from here circle of wheels okay. Mm, during my discussion I actually got one of the candidate he don't know about medulla oblongata. I was very surprised. He don't know medulla oblongata. Okay. Okay. So circle of wheels mainly two artery. One is internal carotid artery and another vertebral artery. They join together to make a circle. Okay. Internal carotid artery. It is coming from where? Common carotid, right? So common carotid coming, it is dividing into two branches. One is coming outside external carotid. One is going inside the skull. That is internal carotid artery. So internal carotid artery from right side, also from the left side. In the very beginning, when we discussed about the base of the skull, and there was um, cila turcica. Remember in the beginning, carotid artery, carotid, cila turcica, or the pituitary. I am asking about the internal carotid artery. So, It's very beautiful to see. Internal carotid artery is very beautiful. Okay. Okay, so internal carotid artery from right side and from left side, they are coming. And subclavian artery, they have one branch. What are the branches of subclavian artery? Yes, vitamin means V for what? Yes, yes. That artery we need now. You can see here. So, yes, vertebral artery. So mainly that vertebral artery, this is the subclavian brachycephalic artery. Brachycephalic artery, then left common carotid artery and left subclavian artery. These are the branches of the arch of the aorta, right? Once again, arch of the aorta has brachycephalic trunk, left subclavian artery, left common carotid. Brachycephalic artery again divided into right subclavian and right common carotid. Just in the first part of the subclavian artery, first part of the subclavian artery or subclavian artery has many branches. We call it vitamin C and D. So vitamin goes for vertebral artery. So in the right side also we have vertebral artery. Left side also we have vertebral artery. Vertebral artery from right side it goes up, 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 up. Left side also it goes up and they join together to form basilar artery. Both sides vertebral artery. So both sides vertebral artery they join together to form the basilar artery, and basilar artery remains just at the level of the pons. You know the where the pons situated, right? Okay. Now let me introduce. She is my friend Nasha, and she is very talented. She has very unique quality of remembering, especially physiology and pathology. She can remember very well, but anatomy also. And she's nurse, recently joined, and we are discussing. Yeah, let's see. We can say hi to each other maybe once we get time. Now see, this is vertebral artery from right side vertebral artery, left side vertebral artery. Both are coming to join together basilar artery. Okay, and basilar artery it remains just over the pons or pontine. Okay, this is the pons. After pons, this part is called actually medulla oblongata. Pons and medulla oblongata. This part, especially this uh, elongated part. Basilar artery again divide into two. Those are posterior cerebral. Again, basilar artery dividing into two. Those are the posterior cerebral. And here we have internal carotid artery, cut margin this side. So this is the internal carotid artery from this side, right side, cut margin, and this is from the left side, internal carotid artery, right? And from behind, from posterior aspect, we have basilar artery, and they are dividing into two. They are called posterior cerebral artery. Posterior cerebral artery, both sides. Posterior cerebral artery, and so if something is posterior cerebral artery, of course, we will have anterior cerebral artery. Okay, yeah. This is anterior cerebral artery. but anterior cerebral artery going anteriorly like this. Okay, we mainly need to know which one is forming the circle. We need the circle because we are studying circle of wheels. So which artery taking part in circle of wheels? First, branches from the internal carotid artery. This is the internal carotid artery. Internal carotid artery, one branch coming posterior. This is internal carotid artery. One branch coming posteriorly. This is called posterior communicating artery because it is making a communication with the posterior, right? So this is posterior communicating artery, and one going anteriorly. This is called anterior cerebral artery. Anterior cerebral artery also coming from internal carotid artery. Very simple. This is internal carotid artery. One branch coming posteriorly to communicate. This is posterior communicating artery. One branch going anteriorly. This is anterior cerebral artery. Same from this side. This is internal carotid artery. One branch coming posteriorly, which is called posterior communicating artery. One branch going anteriorly, which is called anterior cerebral artery. So posterior communicating artery coming, and it is not joining with each other. They are joining with another artery. They are this side also they are joining with another artery, and this another artery join together to form basilar artery. This is that basilar artery, the same. And these two artery are the posterior artery. So this is the posterior cerebral artery. This is also posterior cerebral artery. Again, basilar artery dividing into posterior cerebral artery with posterior cerebral artery, posterior communicating artery joining together, and posterior communicating artery coming from the internal carotid artery. Internal carotid artery giving another anterior branch which is called anterior cerebral artery. Here also, anterior cerebral artery are not joining together. So still there is a gap between our circle is not complete, and to complete this circle we need someone to connect them, and that is called anterior communicating artery. So we have posterior communicating artery which is coming from internal carotid artery. We have anterior cerebral artery which is coming from internal carotid artery. Also both anterior cerebral artery are joined together with anterior communicating artery. So first draw a picture. Here anterior communicating artery, then we have anterior cerebral artery, internal carotid artery, posterior communicating artery, posterior cerebral artery. In this side also, anterior communicating artery, anterior cerebral artery, internal carotid artery, posterior communicating artery, and posterior cerebral artery, and done. This is the circle. If you just keep this information, then this is enough. Otherwise, it will be difficult. Try to draw this picture multiple times and it will be easy. Anyone from you, can you repeat circle of wheels, how it forms? Yeah, go on. Yes, from now onwards, whenever you will say any artery, try to say their branch from where they come. Make it as a habit. Okay. Also, when you say any venous drainage, try to say where they drain. Okay. Make it as a habit. Again, you start anterior communicating artery. Anterior communicating artery. Mm-hmm. Yes. Yeah, yeah. It's not there. Mm, I think it should come by now. It's there now. You can see. Uh-huh. Okay, can you repeat the circle of wheels, how it forms? No, no, no. So you can, yeah. Mm-hmm. Mm-hmm. Yeah, yeah. Yes. Yeah, that's true. We need to know details about the vertebral artery. First of all, vertebral artery, from where it comes? From subclavian artery. Yeah. V for vertebral artery, I for VIT, vitamin C and D. These are the name of the branches of subclavian artery. Vitamin C and D. Okay. V, V for vertebral artery, I for internal thoracic artery, T for thyrocervical trunk, like that. Okay. So vertebral artery, mm, hmm, yes, yes. Anterior spinal artery is different. It is not taking part in circle of wheels. Now we will look about vertebral artery. You can try to read this part, vertebral artery. You cannot see. Okay. You can zoom in your picture, whatever the screen you are using, tab or mobile. You can zoom. can actually. Okay, no problem. No, 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 no problem. We can discuss. Vertebral artery, it is coming from the subclavian artery, and after arising from the subclavian artery, it enters into the vertebral foramen, and it goes up, up, up. When it reaches up to the axis, that is second cervical vertebra, it turns towards the left or laterally, and then again they merge together and they go medially. Then near the and then they enter into the foramen magnum. So the foramen, they enter inside the skull or the cranium, and then they join together at the base of the pons to form the basilar artery. This is the summary. Just we will read. The vertebral artery is the first branch of the subclavian artery. Anatomically, it is divided into four regions. The first part runs to the foramen in the transfer process of C6. So it starts from the C6, and anterior to the part lies the vertebral artery, and the second part. Okay, so first part finished. First part runs to the foramen of the transfer process of C6. On the other side, the thoracic duct is also anti-relation. Okay. Second part runs superiorly. Hmm. Yeah. So first part, what you said, first part they runs through the foramen of the transverse process of C6 vertebra. Second part runs superiorly through the foramen of the upper six cervical vertebra. Okay. Once it has passed through the transverse process of the axis is the second vertebra, cervical 2, then it turns superior laterally to the atlas. The third part runs posterior medially on the lateral mass of the atlas. It enters sub-occipital triangle in the groove of the upper surface of the posterior arch of the atlas. No need this mark. The fourth part passes through the spinal dura and the arachnoid, and superiorly and anteriorly to the lateral aspect of the medulla oblongata. At the lower border of the pons, it unites to form the basilar artery. This is important. So again, first part you can see this is first part. It starts its journey from C6. This is C6. This is the foramen, vertebral foramen. Okay, so it entered through the this vertebral foramen. Then second part it also goes up, up, up. When it reach at C2 level, C2, this is first part, this is second part. Third part, it goes lateral to it like this direction, like this. See here, from here it is entering into this is C1. This is cervical 1 vertebra. Okay, then it enter into the skull, and at the lower border of the pons, they unite together to form the basilar artery. Suppose here in both sides they come and they form the basilar artery, and then basilar artery will go forward and it will divide into posterior cerebral artery. And with the posterior cerebral artery, posterior communicating artery will join. And this posterior communicating artery will come from the internal carotid artery. Internal carotid artery will give another branch to anterior cerebral artery, and anterior cerebral artery will be connected together by anterior communicating artery. The same here also will have. So this is circle of Wills. Now common carotid artery. Anatomy, but same makeup. Not that much important. Just it is important in part B. Common carotid artery. Okay. Right common carotid artery arises from the brachycephaly of the brachycephalic trunk, and the left arises from the arch of the aorta. Both terminate at the level of the upper border of thyroid cartilage, lower border of the third cervical vertebra. This is important. Both common carotid artery, right and left, common carotid artery bifurcate or divide into right and left, sorry, external and internal carotid artery at the level of lower border of C3, or you can say upper border of C4, in between C3 and C4, lower border of the third cervical vertebra by dividing into the internal and external carotid arteries. Okay. Hmm. This, yeah. Okay. Now, left common carotid artery crosses the thoracic duct, and the right common carotid artery crosses the recurrent laryngeal nerve. This is the exam question. The right common carotid artery crossed by recurrent laryngeal nerve. Right common carotid artery crossed by recurrent laryngeal nerve, and left common carotid artery crossed by thoracic duct. Yeah, of course. Hmm. And left by thoracic duct. By thoracic duct. You can see this is common carotid going up, and at the lower border of C3, it is dividing into external and internal. At the level of dividation, normally external means outside and internal means inside. But here, for the common carotid, it will be little different. Internal will remain outside and external will be inside. Okay, little different. So this one, it looks it is inside, but actually this is the external carotid. And internal carotid, from the name, internal carotid, we think that it should be inside, but it goes actually outside or externally, and then it enters into the skull through the carotid canal. Internal jugular vein. Yeah, internal jugular vein. Here we will have the retromandibular vein. This one, retromandibular vein, and it remains in whose relation? In parotid gland, inside the parotid gland. Hmm. Second nerve. Yes, facial nerve, and this is retromandibular vein. Second, you can say vein. Mhm. Greater auricular. Gain. Greater auricular nerve. Faria. Faria. F R A E. NVNA. During exam, if you forget, just write this fourth word. Alphabet. Facial nerve, retromedibular vein, auriculotemporal nerve, and external carotid artery. A. Greater. No. Auriculotemporal nerve. Auriculotemporal nerve. External carotid artery. Okay. Mainly here, see this. Internal carotid artery. From here, we need to remember the branches of the internal carotid artery. Okay. Branches of the internal carotid artery. It is easy. This is internal carotid artery. First branch will be ophthalmic artery. This is the question. First is ophthalmic artery, then posterior communicating artery.
तो सर को कैसे निकला है ना टीचर वहाँ है
क्या हुआ था?
कैसे निकला था
कहाँ पर? आप उधर आ जाइए, देखना है। आप बैठे। कब से आया ये दाना? कितने दिन? निकल। ठीक है, हाँ। इससे पहले भी उधर कुछ था या यही पहला बार हुआ? पहला। हम तो टीका लगाएंगे अभी। टीका एंटीबायोटिक का होता है, और एक टीका होता है दर्द का। हम दोनों ही लगाएंगे, पर इसके अंदर इन्फेक्शन है पास। कभी कभी ये टीका से सूख जाती है, कभी कभी टीका से फर्क नहीं पड़ता है। अगर सूख जाते हैं तो अच्छा है, और हम खाने के लिए भी गोली देंगे। पर आप कल या परसों फिर से एक बार दिखाइए। अगर ये आपको लगे, आपको तो महसूस हो जाएगा कि ये छोटा हो रहा है। अगर आपको लगे ये छोटा हो रहा है, मेडिसिन कंटिन्यू करें। अगर आप देखें ये बड़ा हो रहा है, ये फट गया है, तो इधर आना पड़ेगा, हम वो ड्रेसिंग करके निकाल देंगे। ठीक है। नाम क्या है?
मोहम्मद
मोहम्मद
नाज।
उमर एज
नवंबर इस बार 72।
ठीक है, अभी ये काउंटर में दे दीजिए रिसेप्शन में। ओके, so branches of the internal carotid artery. First branch is ophthalmic artery, then posterior communicating artery, choroidal artery, anterior cerebral artery, and middle cerebral artery. Okay, the branch which one we are observing here, this is the middle cerebral artery actually. Okay, middle cerebral artery. One branch going anteriorly, this is anterior cerebral artery. One branch coming posteriorly to communicate with other, that is posterior communicating artery. And here they have a branch of ophthalmic artery, and this one may be choroidal artery. Okay, yeah. First branch ophthalmic, posterior communicating, choroidal, anterior cerebral, and middle cerebral. From the picture, if you try to remember from the picture, it will be easy. Then first branch say always ophthalmic artery, anterior cerebral artery, middle cerebral artery, posterior communicating artery, and choroidal. Just keep in mind that vertebral artery, when they come together to join and form basilar artery, they have from the both vertebral artery, they have one uh, special artery, that is anterior spinal artery. From both sides, they join together to form anterior spinal artery, and basilar artery first give their branch anterior but inferior cerebral artery. Okay, anterior inferior cerebral artery. Then they have the basilar artery, pontine branches, and then superior cerebral artery. So there is superior cerebral artery and inferior cerebral artery, but this one is in the anterior. So anterior inferior cerebral artery. Okay. This is exam question. Internal carotid artery does not have any branches in the neck. Okay, because their first branch is ophthalmic artery. Nerves at risk during carotid endarterectomy. This is also exam question. Nerves at risk during carotid end arterectomy. Carotid end arterectomy. So hypoglossal nerve. Number, which number? Number 12. This is procedure. Procedure. They do some procedure in the carotid artery. Okay. During that procedure, which nerve can get injured because of their anatomical location? And exactly here we have, if you remember the tongue, 5, 7, 9, 10, 12. So 10 and 12, they come in direct close contact to this. That's why vagus and hypoglossal nerve, also greater auricular and superior laryngeal. These nerves also are at risk. Mhm. Now we can see These all are actually mainly related for part B. Part B, no difference, same thing for part B. Now we finish the internal carotid artery branches, and here we will see about the external carotid artery branches. They have branches, some in the front, some branches in the back, and some branches are deep. Again, some branches in the front, some branches in the back, and some branches in the deep. So front branch, superior thyroid. You remember during discussing thyroid blood supply, we said superior thyroid artery, branch of the external carotid artery. So this is that superior thyroid artery. Then in the tongue we have lingual artery. In the tongue we have lingual artery, and we have facial artery. So yeah, it is confusing, but more and more we read, we will remember. So in the front, just remember, in the front, it is giving supply to the thyroid. First, it is giving supply to the thyroid, then it is giving supply to the tongue, then it is giving supply to the face. So superior thyroid artery, lingual artery, and facial artery. Three branch in the front. And in the back, it is going in the back where? In the occipital. So occipital artery and posterior auricular artery. Auricle means ear, and behind the ear, so it will be posterior auricular artery behind the ear. So occipital artery, posterior auricular artery, and one branch going deep, that is deep pharyngeal, ascending pharyngeal artery, ascending pharyngeal artery, ascending pharyngeal artery. These all are the branches of the external carotid artery. This is external carotid artery. You can see an external carotid artery terminating by two branches. One is maxillary artery, another one is superficial temporal artery. Okay, it terminates by superficial temporal artery and the maxillary artery. Terminates by dividing end branches by superficial temporal and maxillary artery and superficial temporal artery. Yeah, temporal artery, it will come like here. Temporal artery. Maxilla here. Superficial temporal artery comes like here, and it comes in the forehead. So superficial temporal artery, sometimes it gives information to the anesthetist. When they do surgery, they can observe on this. If surgeon is doing some procedure in the lower part, and they are observing in the head. So in this artery there will be pulsation. They can take this pulse. It is called anesthetic oximeter. They can check the pulsation over this superficial temporal artery. Yeah, it becomes visible. So once again, branches of the external carotid artery. Some branches are in the front. Those are superior thyroid artery, lingual artery, facial artery. Some branches in the posterior. Posterior branches are occipital artery, posterior auricular artery, and deep branches ascending pharyngeal, deep, and terminates into two branches, that is maxillary artery and superficial temporal artery. This is my favorite picture. I learned it from this picture. Later on. For this, it yeah, mnemonic will not work here. It is simple. Just if you remember the anatomical location, this is the external carotid artery, lingual artery, facial artery, and superior superior thyroid artery. These all are in the front, and it is terminating by these two. One is superficial temporal artery, another one is maxillary artery, and it is going posteriorly, posterior auricular artery and occipital artery, and it is going deep, ascending pharyngeal artery. Number is not important. They will not ask you about the number. Yeah. Which of the following artery is not a branch of the anterior branch of the external carotid? Hmm. Now, middle meningeal artery. It is a branch of maxillary artery. Very important. This is external carotid artery going up and then dividing into. This is maxillary artery and this is superficial temporal artery. So maxillary artery again it is giving branches. Termination, and then they are giving branches to middle meningeal artery. So middle meningeal artery is typically the third branch of the first part of the maxillary artery. The middle meningeal artery is the largest of the three arteries which supply the meninges, and rupture of the artery may give rise to extradural hematoma. Middle meningeal artery. You can see this. Again, number is not. It will not be appropriate to take any number. Okay. See this circle. This is called pterium, or the most vulnerable part of the skull, where frontal, temporal, and parietal three bones join together. Okay. And exactly this area is the area for middle meningeal artery. Okay. Hmm. Frontal, temporal, and parietal. Frontal, temporal, and parietal. Yeah. They join. Yeah. They join together here. Here. This is the point. So if anyone hit over this area, this is the O's, rather than if anyone hit over here or there, because this area bone also thin, and it is very danger area to be injured of middle meningeal artery. And if it injures, there will be extradural hematoma, and patient will have some lucid interval and those things. Brachiocephalic artery. Brachiocephalic artery, it is very simple, just the branches, subclavian artery. Again, yeah, here is the vitamin C and D. So, vertebral artery, internal thoracic artery, hyocervical trunk, costosalvoical trunk, and dorsal scapular artery. Okay, you need to remember the branches of the subclavian artery from here. Vertebral artery, vertebral artery, mm-hmm. Yes, brother. See, yes. What happened? Hmm. Name,
Swadrup. Swadrup.
age,
Yatsuma.
hmm. You can go to pharmacy and take this medicine.
Okay.
internal jugular vein. Each jugular vein begins in the jugular foramen, where they are the continuation of the sigmoid sinus. Yes, both sigmoid sinus. Mhm. And how sigmoid sinus forms? Okay, sigmoid sinus and inferior. Let's see. They terminate at the medial end of the clavicle and they unite with the subclavian vein. So internal jugular vein, the vein lies within the carotid sheath and the jugular foramen as a internal jugular vein. They starts or the begin at the jugular foramen as a continuation of the sigmoid sinus. Yes, we have seen inferior petrosal sinus and sigmoid sinus. They both join together to form internal jugular vein. Internal jugular vein uh, unites with the subclavian vein. So this is internal jugular vein, and they are joining with the subclavian vein like this to form innominate or transcervical or innominate or brachiocephalic. Innominate vein behind the sternal ventricle, and relation aside it lies inside the carotid sheath lateral to the internal and common carotid with vagus nerve in between. So this is subclavian vein, internal jugular vein. They are joining together to form brachiocephalic vein, right brachiocephalic vein. Okay, I will also conclude today. Yeah, now this is the cranial nerve. Cranial nerve we will discuss in different topics. Today we will finish up to here. Okay, next when I start, then I will send you the link. Okay, okay, then we are concluding here.